on episode 4 of the podcast, Pilanami Foundation. I hope you are all well and good. We're talking everything TB. If you can remember, last time we spoke about TB treatment on children. So today we are discussing TB in adults or bandla abadala above the age of 5. Welcome again, Dr. Gugu Nhleko. You are welcome. Thank you again for spending some time with us. And as we get into TB treatment, for us, fortunate nalabanye who are younger and older, you are welcome.
Thank you for having me.
Doctor, we're talking about treatment here, TB. I remember you've said in previous episode that a lot has improved. The MDR, I was like Bosanta for many months, still trying to treat the TB. You told them my injections are fortunate, where you have to go to the clinic every day. You told them job with your card. Now our government has improved so much on this treatment. Injani TB treatment yebantu labadzala or yebantu libangasibo bantwana?
Okay. So TB treatment ku bantu abadala, firstly it depends on ukuthi une TB enjani. Okay? So it depends ukuthi une TB le sibiza ngokuthi MDR, which is the TB that is now a drug resistant or resistant to the medication that we normally use, or you've got normal drug sensitive TB. Okay, so we'll start with
the normal one.
When you break that down, it depends on where is the TB. So TB of the lungs, TB that's not very severe, we treat it for 6 months. However, if you've got TB that's a bit more severe, so for example, if it affects your brain, if it affects your spine, if it affects your bones, we might need to treat you for longer, sometimes 9 months, sometimes we can go up to 12 months. So with drug-sensitive TB, depends uti le TB le igupi. Okay? And then when it comes to EMDR, like you were saying before, bekthatha imjovo for 24 months sometimes. So nakhona, depending on where the TB is, and if you've never had it before, you don't have very complicated resistance, na EMDR, we can treat it for 6 months. But for some patients or for some people who have severe disease or who fit certain criteria, they might end up having to take it for 9 months or even up to 18 months.
As you're talking, I'm thinking, and when you start taking, then you started taking the TB treatment, big ginger, even when you're going to the toilet, your number 1 and 2 changes color. How is the treatment now, and what are people saying? Does it still change? Is it still the same since the treatment has improved?
Okay. So with your normal TB or your drug sensitive TB, the medication is still the same from back then. So lumkamo still usapumu orange. Yes, upumu orange, but it's just a dye from the medication itself. It's not the bacteria coming out. It doesn't mean ukuthi khona la ulimala khona. Unfortunately, it's a harmless side effect, if I can put it that way.
Okay.
It's just a byproduct of the medication that needs to come out through your urine. But once you stop the TB treatment, or once you are done with treatment, then umkama wako will go back to normal.
My side effects my pills, you just mentioned that it's a harmless one. Do we have harmful side effects of TB treatment?
We
and
do.
What are they?
Yes, we do. So one of the most harmful side effects that we worry about when someone is taking TB treatment is the side effects on the liver. So we call it, in medical terms, we call it hepatotoxicity. So it can affect the liver. It's not everyone and it's not all the time. Okay. But especially our clinic, when we monitor you every month, so we check the medication has not affected your liver. But there are some things that when as the patient or zendayo that could result in you now having liver damage, which will be made worse by the medication. So that's why if you're on TB treatment, because utshwala can also affect the liver. Mm-hmm. If you are someone who wants to take traditional medication, and we're not sure what impact it will have on the liver, there's even other certain drugs that can impact the liver. So when you're on TB treatment, if you want to even buy something else at the pharmacy, you have to consult your healthcare practitioner. So that's one of the side effects that we worry about that can be very harmful. Then we have side effects that can be very uncomfortable for you as the patient. Mm-hmm. So what we call peripheral neuropathy. So you get pins and needles in your hands and your feet. Mm. But yes, so that's one of the side effects. So when you experience Leo side effects, let your healthcare worker know, because there is treatment for that. Yes. Yeah. Mm. So that's what we call peripheral neuropathy. So that is also a very uncomfortable side effect of the medication. But like I said, wonke lama side effects. Earlier on, when we did the episode on TB in children, we spoke about nausea and vomiting, and I said that sometimes it's not the medication, sometimes it's something else. Even the liver damage can cause nausea and vomiting. So if you're taking the treatment and it's making you vomit, you actually need to see your healthcare worker so that we can assess, is it because of the medication or is it because of something else?
Okay. I think earlier on we also mentioned that TB treatment, it's more of a very strong immune booster, because uthola umuntu bekalele phasi ane TB, in a month or two uphilile uyagijima. Kubaluleke ngani to finish the treatment once you started?
Okay. So before we get to that question, I'd want to first break it down, the phases of the medication, mm-hmm. right? So missing 6 months, uqala ngale sibiza ngokuthi intensive phase. So lapho we combination yama drugs are 4. So lapho we are going in very aggressively into killing the bacteria. So kule intensive phase, even within 2 weeks, you are no longer infectious, meaning it will be very difficult to because that's how much of the bacteria that you've managed to destroy in the first 2 weeks. So we give the intensive phase for 2 months. And then after that, we give what we call a continuation phase. So lapho we combination yama drugs out too. So that's now we are cleaning, we're just sterilizing, mm-hmm. So now the danger of stopping your treatment means if you stop while we are still trying to aggressively treat it, or you stop while we're trying to now clean and sterilize, then what will happen? The bacteria atovuga and start multiplying again, and then you'll become sick again. But the most dangerous part is because the bacteria isiyazi ukuthi mina bangihlasela ngalamaphilisi lawo, it will then change itself or mutate, and that's when some people will develop what we call MDR or drug resistant TB, because now you've given the bacteria a chance to grow. Okay, maybe so I need to change myself so that this medication no longer works for me. I think that's the simplest way I can put it.
Njengoba ubala ukuthi iyajwayela ukuthi nyalo treatment behamba, so how does it change now that TB came for the second time and now I have MDR? And does the treatment change, or is it still the same treatment? It's just that the medication, the for 2 months, now it's for 3 months. What's the procedure? Or utola a different, completely changed medication?
So you have to get a completely changed medication. How I usually explain it to my patients is uti. It's like if I had to keep punching you with my right hand, eventually you know uti there's a punch coming from the right. Eventually, what are you going to do? You'll duck. Yes. So now when you develop resistance, now I have to now come from my left because you're not expecting me to come from my left. So that's why your treatment has to now completely change, because the medication that was working for you before will no longer work for that particular person because the bacteria knows how to duck now. So you have to come with now something different that the bacteria has not been exposed to.
In general treatment, because I remember Angisho before, the left fist was the injection. What are people getting now when they have the MDR?
So the left fist is the normal TB medication, le refer for lena that abantu bakhala ngokuthi, oh, when I go toilet to pee, my urine is orange. Yes. So now the left fist is le treatment the MDR. So akusajova anymore. It's all oral, meaning ukuthi amapilisi phela that you take for 6 months, and even the pill load isiyehlile kakhulu compared to previous years. But obviously uthatha amapilisi amangaki, even like the normal TB treatment depends on your weight. So the bigger you are, the more tablets you have to take. So mina now nje 5 tablets is your time. But someone smaller will need to take less tablets. So treatment TB, the dosage is according to how much you weigh.
As we are wrapping episode 4 now on TB treatment, Doc, what can you say to people who have started their treatment, and maybe to remind them about the importance of taking the treatment and finish the course?
Okay. So what I would say to someone who's already started the treatment, it's very difficult. We don't deny that. I think most people even struggle to take antibiotics for 5 days. Nami, I'm guilty. I'm one of them. It's very difficult. So TB treatment are my antibiotics now, essentially. So I can imagine having to take antibiotics every day for 6 months. It's difficult. No one says that it's an easy journey, but it's a very important journey for you to complete. Some people usually stop because they feel better. Besides, saying right, I'm going to stop. But remember, we spoke about Uti. We have different phases of what we're trying to do when we're giving you the treatment. So stopping treatment, increase the chances Uti you will develop drug resistance. That's the first thing. Secondly, you are likely to get sick again. So it's very important to complete your treatment. The other most important thing that people need to consider, once TB, if you've started treating it and you stop and you either develop MDR or you become sick again with active TB, you can pass it on to your loved ones. And you don't want the people around you to be sick because you didn't take your treatment. Other people stop taking their treatment because of the side effects. Now I can imagine if every time I take something it makes me vomit, I'll stop taking it. Or if I take something and it makes my feet hurt, I'll stop taking it. But because of the reasons that I've just alluded to, it's very important. If you experience side effects, do let your healthcare practitioner know, Uti, I'm experiencing this and this and this, and that's what we are there for, to help you overcome and help you through your journey of TB treatment until you complete, not just for you, but for the people around you.
It is very important, Doctor. I will have to agree because I took TB treatments about 3 times. And that time it was difficult. It was hard. I remember that time when I had to go back, I sat with the healthcare worker and I cried. I'm not going back because I'm not that kind of a person who will come and sit now at the hotel and then you talk and I listen and I don't ask. I want to know about everything. So I remember that time, Bati, no, Nasi ibuile, yabo. Nasi, what? Why? What happened? And she explained, but as she was explaining, bengasa move because I wanted to know, Gusi, then now what's going to happen? And as she was explaining, Gusi, njengoba sendile like now. And anagasin njengoba sendile, I'm coming from injections. I still haven't recovered. You know that injection be going to open it, kadla, you know, in your palms. And then now are you telling me to go back to that? I asked her, and I said, okay, are you going to do it on the thighs or Jan? Well, I said, we will find a way there. I broke down. It was one painful thing. But I went back and look at me today. That's why there's this baby called Pilanami. So guys, I hope they put numbers on the screen so you call us. We also give out advices. We also do counseling. We have Dr. Gugu with us. Please, let's fight the spread of TB. This is the end of episode 4. Thank you so much. I am Fortunate Kambule.